Hi parents, hi teachers, hi physicians, and other mental health providers. This is Leslie Blevins, and I'm with Enilda Clinic at enildaclinic.com. Thank you for joining me today. We are going to talk about Board Certified Behavior Analyst, or BCBAs, and their specialty, Applied Behavioral Analysis. So I am a BCBA, and I'm excited to tell you about this particular behavioral health specialty and how it can support your child whenever your child has behavioral health needs. It's a little bit different than perhaps a licensed counselor or a marriage and family therapist or even a psychologist. A BCBA is somebody who really understands the physics of behavior, and so they're getting down to the very fine detail of what's happening with the behavior. They're looking at the triggers for the behavior, and they're looking at the consequences that occur whenever that behavior occurs. And so over time, what we find is that there can be patterns for specific behaviors in certain environments, and that leads to that behavior being maintained. And it creates a learning history for children and for everybody really, and for every living thing. And so what we learn over time in applied behavior analysis world is how to start identifying those patterns of context, and inside that, the triggers and the consequences that maintain either inappropriate behavior or the things that we can put in place to help your child to learn more adaptive behavior. And so there are 7 dimensions of applied behavioral analysis. The first one is that ABA really focuses on observable, measurable behavior, and that's really different than talk therapy. Some forms of talk therapy will focus on this, but ABA explicitly focuses on this to the exclusion of any kind of thing that we can't observe and measure. And so for instance, if we were to think about anger, I can experience anger and demonstrate it in several different ways. Like maybe I can slam my fist down, but I could also get really excited and be like, ah, and slam my fist down too. And so things like emotions are thoughts. Those are things that we would think of as being more mentalistic, and they can be expressed in a variety of different behaviors that oftentimes don't have that point-to-point correlation. And so in ABA world, we focus on just the observable behavior because we find that that creates more consistent patterns that we can change and cause socially significant effects. So that brings us to our next dimension of ABA, or behavioral health, and that is that the interventions that we use, we want to always be able to demonstrate that that intervention itself is creating the change in the behavior. And this is really important, I find, in the therapy that I'm doing, because I want the parents to understand how much power and control they really do have on their child's development. Sometimes I'll have parents coming in, and across a few months of therapy, the parent might be trying another intervention or two, and I'm saying intervention loosely. They might read about something on the internet, Dr. Google, or they might hear something from a good intentioned neighbor or someone like that, and they might try that too. And it might be at a very crucial point in the intervention process for what we're doing, as their child is already experiencing quite a bit of gain, and their child is starting to experience that pivotal point where they're starting to take ownership of the change and generalizing that change to be more independent. And so sometimes the parents start to get some ideas in their head about, well, what's really causing this change? That's why it's so important, because every change that you make in your home is effortful. You have to be very intentional, and you have to do it consistently until your child can be independent and take ownership of those changes to do them themselves. And so in ABA world, we like to be able to demonstrate that an intervention and the components of an intervention are being effective for the behavior changes that we're going for, so that we know what we're doing and what we can do in the future to make an impact in that child's world. The next one we have is that any interventions that we're doing in ABA should be specific enough and written out clearly enough that that intervention could be done by another person. It could basically be replicated. So this is the technology of ABA. We're not creating lasers or anything like that. But what we are doing is we are creating interaction patterns that are very specific, and they're based on theory, which will be one of the next dimensions that we talk about. But they're very specific, and they're designed to create a new context for your child so that they experience new consequences or new triggers so that they get to have more adaptive behavior, and so that maybe potentially trigger behavior that is maladaptive starts to decrease. So the next one is what I just mentioned, that the behavior strategies, the interventions that we use in ABA are based on a theoretical grounding or a research database. They're not just tips and tricks that are anecdotal. There might be some logic to it, but oftentimes whenever I'm talking to parents for the first time or we're going through therapy, many of the things that I'm saying to them actually feel counterintuitive. I might be asking them to ignore some problematic behaviors, but of course I'm always going to be pairing that with other strategies too, to build this comprehensive program that's built on the literature and the theory of how we know behavior works. And that's a big part of ABA, that I'm not just putting together a bunch of tips and tricks. And that's actually one of the reasons why it's so hard to put together intervention videos to put on the website, because every child has a very unique context for their behavior. And so I find that whenever I'm trying to think of an intervention video, there are very few things that I can actually put on a video that I think might reach a more general population. And so what I tend to do is just stick to academic interventions that have a good data base to support them. Just as an aside, yeah. Okay, so next is that ABA always focuses on difficulties that have social significance. And so what we don't tend to see is that we're trying to manipulate people into doing things that aren't important. We're always really trying to elevate somebody's behavior so that they are being able to live an adaptive life, so that they're able to access opportunities to give themselves the life that they want, to be able to, make more friends, or to be able to be inside the classroom for longer, to be able to access that learning opportunity, to be able to go to new places, to be able to tolerate and eventually even enjoy being in new environments. And so that's really what ABA is focused on. And then next, what we have is that the interventions for ABA are truly designed from the get-go to be generalizable. So what that means is that we're not trying to do an intervention that will only work in that one place where we've taught the intervention. What we want to do is actually create an intervention that can, over time, support your child in utilizing it across different contexts, whether that's school, at the park, at home, at grandma's house, wherever it might be, and even with different people. So mom, dad, brother, sister, teacher, grandparents, whoever it might be. And we want the child to, over time, also be able to take over ownership of the intervention, being able to do it more and more independently. And so all of that, those levels of generality are taken into account whenever we're building an intervention, so that, again, the child's needs are being considered, and the family's needs too. And then the last dimension of ABA, or behavioral health, is that what we want to see with an intervention is that the change in behavior has social significance. And so this is a huge difference from your traditional psychology research that we see whenever we're testing an intervention, because what we do in ABA is we do single subject design. That's where we have either one individual or a group of individuals working on one particular behavioral skill. And what we're trying to do is make a change in ABA that is socially significant. So again, we're trying to give that person access to something meaningful in their life. But in the psychology world, oftentimes our data collection is across many people, sometimes hundreds or even thousands of people, and we're looking for statistical significance there. So what that means is, did the change in outcomes occur more often, or was the change greater than what we could expect, more than chance? And we don't really do that with ABA because we're looking at the context of the behavior. And so for one child, their difficulty with tantruming will be very different than another child who's having difficulties with tantruming. And what we want to see is a change for each of these children that's socially significant. So we want their family to feel and perceive and believe that they have a difference in the outcome of their life, and for this child to even have an outcome in their life that's socially significant. So what does ABA look like compared to your traditional talk therapy? Well, ABA has great evidence, and it's supported and recommended by various governmental agencies and advocacy agencies for autism and for people with developmental delays. I think that's probably the most well-known use of ABA, but it absolutely is also used for other difficulties, for behavioral concerns. I've used it for adults, typically functioning adults who have health-related concerns, things like smoking cessation, weight loss, chronic pain, and anything where we're really thinking about altering the way that we engage with our environment or the cues that we might automatically respond to, that we want to develop a better awareness to, and we want to change our behavior so that we get better consequences that help us live a better life. Now, of course, this type of therapy, ABA, is going to be very helpful for young children. So whenever we think about comparing ABA to your traditional talk therapy, this is where ABA really does a great job, because young children don't have abstract language. And so to really engage a young child, so under about 6 years old, it's hard to engage them in their emotion, reasoning, and cause and effect, and understanding what happened in the past, and holding on, even if they understand it in the moment, to hold on to that concept and then to self-generate that rule at a future point in time so that they could rehearse it. All of that's very difficult for a young child. And so using ABA for young children is especially impactful. And that's what I do in my practice here at Enilda Clinic. I use it for tailored interventions as needed for individual families. And so whenever they come in, many times I'm teaching just basic good behavior strategies based on ABA principles, and then building in those into a package that's comprehensive for each unique family, so that my number one goal is so that parents understand the physics of behavior themselves. I want my parents, whenever they graduate out of therapy, to come out of it saying, I feel so confident that whenever we tackle a new problem, right, because new problems are always going to happen, whenever we tackle this new problem, we can modify the interventions we've learned and these concepts we've learned so that we will be successful in the future, and our child will continue to grow and be healthy, and we'll have this awesome life. And so that's how I use ABA. Something important whenever you're deciding on a BCBA, so a board certified behavior analyst, those are the people who have met rigorous training and practice requirements in order to have a basic training minimum to practice ABA, okay? So whenever you are looking for an ABA provider or a BCBA, or board certified behavior analyst, Some of the things to think about is that everybody specializes a little bit differently. So I specifically like to focus on parent training and working with young children with a variety of behavior problems or emotional problems, anything like that. And then I also work with older children that do have a developmental delay. And I do that again through working with parents, but also using acceptance and commitment therapy, which is kind of like the language version of ABA. And other BCBAs will utilize a different, the same principles, but they will utilize those principles to possibly address a different type of population. Some people will focus on kids with autism. Some people will focus on severe and aggressive behavior. Some people really like to work with families inside the home, and so they actually build their practice by training behavior technicians and going out to the home and really supporting a team to be there throughout the week to give really intensive care. Some people have centers, and they'll even have speech language pathologists and OTs and other types of providers there so that they can give good comprehensive care in a center where other children are coming in and maybe more of a social skill development can occur. And there's just all kinds of things that can happen with ABA. So that would be a big question to ask if you're looking for an ABA provider is, what is your specialty with ABA? How do you practice ABA, and does it match what my child needs? So I hope that you've enjoyed this video today. If you'd like to learn more about my skill set with ABA and with psychology, you can always go to enildaclinic.com, and I look forward to seeing you here again later.